Yeah.
Yeah. Okay. Hi. So, yeah,
Just
sound check.
yeah, just
be fine.
I
promise I will meet you right. So, yeah.
A B C D E F G H I J K L M N O P Q R S. I know. Hi, Don. I would love to meet your wife.
She's right there.
Is that okay?
Yeah, let me move this closer for you.
Okay, I can also talk louder.
But I mean, you can hold as close as you need.
Yep.
So,
No, that's okay. I will be loud enough. It's never been a problem before. Hi, I'm Dee.
Oh, nice to meet you.
So
I'm
nice
Lynn.
to meet you.
I'm
I've
Preferences.
had such a great time meeting you.
cool.
I know.
We have great conversations.
Yes, we do.
Really, it's a lot of fun. So nice to meet you as well.
Great to meet you too.
For all the rest of me, it's like, what?
I was like,
What?
and I
What
kid
could
you
you
not, there's
possibly
not
Me
a
too.
little thing that's like
think a lot. Families are before the
I'm feeling the sandwich thing. I moved my dad into the apartment because his rent went up $800.
I'm just saying that there's a timeline for city council and contracting, but doesn't like if it isn't figured out tomorrow and start through the process.
Yeah, and he's still working.
It's not like
He will probably be working longer than he wants to because he's now in Littleton, but he wasn't.
yeah. So I'm pretty excited.
Yeah, we're not.
I'm just I only have I only have control over certain parts of it.
Right. Okay.
And that's all I can
Yep.
do.
Conversation.
Right.
Another future conversation is helpful.
So I think everybody's in sort of a
Yeah.
Talk to me or
Okay.
just
Cool.
say yes and no. It's helpful.
Great. Okay.
and the relationship with the mayor and the city council is deteriorating.
Yeah.
That's rock and roll.
So I don't know where it's going to go.
Good evening.
Hi.
Welcome to Calvary Baptist Church of Denver for this important community conversation about homelessness in our city. My name is Ann Scalfaro. I'm the senior pastor here at Calvary, and we're really grateful that you're spending some of your Tuesday evening here with us. Some of you are here in Fellowship Hall at Calvary, others of you are online, and we're grateful for all of you. A huge thanks to our tech team here at Calvary that's live streaming this event and making it accessible. So thank you, Tom Madden and Corey Kreil and Bill Warren, for all of your work. And a logistical note for those of us in the room, men and women's restrooms are located just around the corner here to your right. Go down that hallway and take a little left. There's another set of men and women's restrooms located through the lobby area. Take a left and they're right across from the main office. And then gender-neutral restrooms are located across from our youth lounge. You just walk all the way across the lobby, past the welcome kiosk, and you'll see the youth lounge area. One of the reasons that we're here tonight is because we all care about our community and people in our community. And Calvary, our vision statement is to be open to all, closed to none. We are an inclusive community. We seek to be that for people of all faiths or no faith. So know that as we're meeting tonight in a house of faith, you are welcome, whatever your belief system. And just as a word of respect, here at Calvary, we respect all people, all life experiences. And so we request that tonight that we use respectful language as we talk about those who are experiencing homelessness and as we talk with and to our panelists and guests here tonight. I'm very grateful to Calvary member Pat Hagan for coordinating and kind of dreaming up this panel discussion tonight, and for her work with her friend Don Burns, who you'll be introduced to in just a moment. But we are here tonight in part because of our experience at Calvary in recent months. In addition to hosting families who are experiencing homelessness here in our building several times throughout the year through our partner ministry, Family Promise, we also have a ministry on Mondays, a hospitality ministry that we've had for 10 years, where people can come and take a shower, do some laundry, receive a bus pass, get a grocery card. And we've noticed really in the last year or so that the needs of our guests, their concerns, their experiences have really changed. And we've actually had to pause that ministry as we evaluate our capacity as a church and as a program that's run by volunteers, our capacity to meet those changing needs and to consider things like safety and liability, as well as are we helping or are we causing more harm? And so as our church is asking these questions, we wanted to engage the community and have collective wisdom and voices around this. Because really we know our city is in a housing crisis, our state is, and our country is. I'm so grateful to Ian Fletcher, who has agreed to be our moderator this evening. Ian is a regional strategy lead with Community Solutions, a national nonprofit focused on creating lasting systems to end homelessness. Previously, Ian also managed a large veteran homeless grant in Colorado and worked as the Director of Best Practices for the Metro Denver Homeless Initiative Continuum of Care and for the state of Colorado during the COVID-19 pandemic response. Ian has a 10-plus year history of working with public housing authorities, the Veterans Administration, and homeless service providers, with a primary focus on reducing and ending veteran homelessness. He holds a Master of Public Health degree from the University of Illinois, Chicago, and a Master's in Social Change from Iliff School of Theology here in Denver. He's also the husband of my colleague, Reverend Morgan Fletcher, who is also a pastor here at Calvary, and he's the father of 2 adorable toddlers. So thank you, Ian, and thank you, guests.
Thank you, Pastor Ann. And for especially folks in the back, if you have audio issues, please just flag can't hear. We also are going to make sure our folks who are participating virtually can also participate as well. Just some notes about kind of run of show this evening. I'm going to ask some questions of our panelists. I'm going to do some intros for them, ask them some questions. You all should have received some cards that you can write questions down on. As well, we'll receive questions via the chat for those who are participating virtually. And we'll have time, we'll save those for the end. And we'll probably filter through, maybe some of them got answered if you've already submitted them, but we're going to run through those. So please ask your questions at the end, and you can hand them as they come up or as we take a moment to either Pastor Ann or Pat Hagan over there, or if you need more, if you just have so many questions, we've got plenty of index cards. So I'm going to start with some introductions, just some context as well. Cole Chandler from the mayor's office will be joining. He's at a meeting right now in Montbello, so he's going to wrap that meeting up, come down here, so he'll be joining in a bit. And then Dr. Patrice Hairston Peets unfortunately came down with some illness a couple days ago, and so is not able to join us. She was a scheduled panelist as well. So I'll go through our bios, starting with Cole, so that when he comes in, he can just hop in and we'll go from there, and followed by the rest. So Cole Chandler is a collaborative and solutions-oriented leader working to address Denver's housing and homelessness crisis as Mayor Mike Johnson's senior advisor for homelessness resolution. Prior to joining the Johnson administration in July 23, Cole served as the first Director of Homelessness Initiatives at the Colorado Department of Human Services, as the co-founder and executive director of the Colorado Village Collaborative, where he developed Denver's micro-community model, and as a live-in volunteer at the Denver Catholic Worker House, where he learned about Denver's housing and homelessness challenges firsthand from housemates coming directly from the streets. Cole holds a Master of Divinity from Baylor University, where he began to embrace his lifelong passion for creating social change. He loves skiing, biking, and running, and lives in North Denver with his wife and 2 young sons. And then I'm going to go in order this way. So Don Burns is the founder of the Burns Institute for Poverty Research at the Colorado Center on Law and Policy. He has co-authored 4 books on homelessness, one of which is very recent, I believe, right, Don?
Hadn't even come out.
Hasn't even come out yet, so you all get the preview, which is really exciting. And he has worked in this field for almost 40 years, including almost 20 here in Denver. Dee Dee DePearson, Dee Dee, did I say that right?
Yes, that's
okay,
really good.
Great. Is a nonprofit executive and strategist with over 20 years in senior management, building successful Colorado organizations to affect social change. She is passionate about the independent sector and is dedicated to innovation, systems change, and cross-sector collaboration and advocacy. Dr. Jamie Reif currently serves as the executive director at the Metro Denver Homelessness Initiative, an organization collaborating efforts to end homelessness in the Metro Denver region. Previously, Dr. Reif spent over 15 years in public education. Most recently, she served as the state coordinator for the education of homeless children and youth at the Colorado Department of Education. Before relocating to Denver, she spent 12 years in Metro Atlanta, school district as a director, school administrator, homeless education liaison, and classroom teacher. Dr. Reif conducts research on poverty and homelessness and is the co-author of the recent book, Journeys Out of Homelessness, The Voices of Lived Experience. Her volunteer time is spent mentoring young adults in Denver Metro and as a board member of the National Association for the Education of Homeless Children and Youth. Awesome.
Well said, Ian. Well said.
So a few call outs as well for our panelists. We all speak in a particular dialect and jargon that maybe some of our esteemed attendees may not speak. So attendees, if there's something that you're not understanding because we are using acronyms or a term that we use all the time, but that we want to make sure that this is accessible for everyone. So please just, feel free to holler out. What do you, when you say that, what do you mean?
You can throw an index card at us too.
Yeah.
If you like. That's the other
Make it
purpose
a paper
of them.
airplane. So we're going to dig right into our questions to get started. And then, again, as I said, as we're going along, if you have questions, please write them on the cards. In particular, if you have a question for a particular panelist, please just, say, to Jamie or to Don or to Dee Dee, and we'll make sure that gets directed to the right folks. So the first question I want to ask for everyone is, can you share something that you want the public to know about homelessness in Denver that feels important for the overall narrative around such a challenging issue? And I'm going to start with you, Jamie.
Oh, okay, just one.
Yeah, you
Okay.
can have as many things as you want.
Okay.
Yeah.
So I think there are a couple of things that I want to kind of share and just make sure people understand. I think the first one is homelessness is a housing issue. I'm going to say that again. Homelessness is a housing issue. The cost of housing is so incredibly high in our region that is the leading cause by far of homelessness. The next thing is that homelessness is not a choice. When you talk to people experiencing homelessness, 95% consistently say that if they had a place to live, that's where they would be. And so it's a very, very, very small minority of people who actually, it's a quote unquote choice, but many of them, even if given a housing option that meets their needs, they would absolutely take it. So I think those are important to understand, that it's a housing and economic thing, and it's also not a choice. I think the third thing is that you cannot talk about homelessness in this country without talking about race. Homelessness is the fallout of several systemic failures like criminal justice, child welfare, education, healthcare, all of those things that disproportionately contribute to the number of Black, Indigenous, and people of color in this country that experience homelessness. So we have to talk about race if we're going to talk about homelessness.
That's a little bit hard to follow because it's a lot of what I think all three of us would say. But I think, I'm louder. Yes, okay. I think I'm the newest person here. I started my job in mid-March and came from sort of healthcare reform, not housing. And one of the things I'm really struck about when I took this job is how many of the people I know, friends, family, other, then came up and said to me and started to talk about their stories or their family stories of being housing unstable or being unhoused or experiencing homelessness. And they're like, I don't ever talk about it out loud. There's still so much stigma associated with it, even among folks that maybe you wouldn't expect it from. So that was a learning for me that I just wanted to share with you. And the other thing I'll say is lead with systems. When I talk to people a lot of times, they lead with a lot of myths they have about people experiencing homelessness and sort of individual decisions or choices or that kind of thing. And they're not leading with the systems that created this, which is sort of echoing what Jamie said. But lead with the systems first. What are the systems that created this problem? And focus less on individual choices or what you might see as, anyway, just individual choices, right? That's not where this sits. It sits with the systems.
I'm going to use a term that some of you may not know. NIMBY. Not in my backyard. And one of the things that really distresses me is the number of people who say, oh yeah, we know it's a problem, and we know you need to do something, but please do it somewhere else. And I'm afraid that a lot of that has to do with lack of information about who people are who are experiencing homelessness. There are lots of stereotypes going on. For example, everybody says, hey, you bum, get a job. Well, in fact, something like 45% of people experiencing homelessness are already working, most of them full-time. So get a job doesn't mean anything. In addition, people say, well, they're there because they were alcoholics or drug addicts or mentally ill. But we know that from the standpoint of the folks themselves, job loss, inadequate wages are among the most important causes of homelessness. And those are systemic in nature.
Thanks, Don. And as we think about, opportunities, Dee Dee in particular, you mentioned like this sits at the system level. What is an unmet need or an area of improvement for our systems and the providers who are either what we would kind of say is upstream from these folks that are ending up homeless, or for providers serving people who are currently experiencing homelessness? What do you see as kind of an unmet need, and what do you see as the path towards meeting that need or making the improvement?
Starting with me. Hi. That's such a big question, but I'm gonna start with, and I'm sure Jamie and Don can fill in. I'm going to start with the fact, and it's not surprising, that the silos we have in place among the different systems lead to sort of catastrophic results. I mean, I think one of the things I was struck with when I started this job is the siloing between folks in serving people experiencing homelessness in the homeless sector and the housing sector, huge silos. But then we see silos within government agencies and silos within funding streams, and the work we do is so hampered, and the change we want to see is so hampered by these inflexible silos and the sort of the turfism that sometimes happens. So if there was like one piece of the pathway, I think breaking down those silos and connecting systems would be a great first start.
One of the things that you all may not be aware of is that in the city of Denver, almost 80% of the land is zoned for single-family housing. Almost 80% of the land, which means that unless you get a special waiver, you cannot build multifamily dwellings. So, how do you go about building housing for lots of folks who need it? The path towards solving this problem, well, we have to get to the city council, we have to get to the mayor, and let's hope that next year in the legislative session, the governor is able to move forward on some changes in land use and zoning.
Oh, wow. Okay. There's so much with systems. It is complex. We are siloed. We need a lot of different changes. And I think one of the things that we need to do as a system really is question, why do we do things this way? And is this the best way to do it? Speak up is what I'm getting. Is that better? Thank you so much for telling me. I appreciate you. So I think one of the things we need to really focus on is like, why have we done things this way and what can we do better? Because while, you know, there are always like systemic challenges and things that happen, there are also things that we can be doing to improve them. So I look at like the work that my organization does with Ian's daytime job. And really what can we do, testing things, taking things bite by bite, right? This is a really complex issue. And we didn't get to modern day homelessness like yesterday. This is decades in the making, and it's going to take us decades to get out. And it is solvable, but we have to do it kind of bit by bit, piece by piece. And I think one of the things that I just want to caution everyone about is thinking there's like some magic solution for homelessness, that if you just do this or do that, we're just going to magically fix it. Because that's a very misinformed solution, honestly. Like, there is no silver bullet for homelessness. We need to have more housing, we need to have systems level changes, and we need to do the work that is necessary to change a lot of systems to get us there. But there isn't like one, just like wand we can wave that will make homelessness go away. So I just want to like put that out there. There's a lot of things we can do, and it's just going to take some time. It took us time to get here. It's going to take us time to get out.
I would add to what Jamie has just said. There is a strong tendency for a one-size-fits-all solution. And because of the complexity of this problem, I'll tell you, one size doesn't fit all. And we have got to be more open to creating different kinds of solutions for different members of the folks who are experiencing homelessness.
Can I add to that? Do we get to? Okay. I think one of the things too to recognize is I think when a lot of people think of homelessness, I'm going to go like this because I'm like scrunching over. When people think about homelessness, you tend to think about the person that you saw maybe on the drive here tonight, right? Or the person that you see standing on the corner panhandling. The reality is, to Don's point, like for every one person you see, there are 3 more you don't see who are in shelter, they're in transitional housing. They tend to be young people, families, the aging population. And what we have to do is be building solutions not just for the people we see, but the people that we also don't see that are in these other kind of living situations. Because that's the thing, we can't just build a one-size-fits-all approach. We have to make sure we're meeting the needs of a very diverse experience.
And I'm going to add one thing to that too, sorry Ian, which is we are not spending anywhere near enough time and resources on the preventative end of this. We do have the basic income project, but like so much of homelessness could be prevented by, you know, compared to what we spend, like a trickle on the front end when people become housing unstable. It's such, you know, in everything, in healthcare and housing, that preventive piece doesn't cost that much, but is so critical if we want to sort of get at solutions.
Yeah, and I'm going to keep adding. So with that, to prevent, yeah, I hope this is okay.
This is
like
exactly
so much
what we
more,
want.
I'm sorry, exciting it's got to be than just like answer. Next question, answer. Okay. So with prevention, our data show that it's about $1,400 to prevent a household from becoming homeless. To rehouse a household, it's between $8,000 and $10,000. So the answer is, let's just prevent it before it happens. Let's keep that eviction off the record. Let's prevent that household from experiencing trauma. And one of the things during COVID that we had, which was amazing, was a lot of rental and mortgage assistance. And what we saw is that it's super effective in preventing homelessness. Like, had we not had that, we would have been in such a worse situation, but we did, and it works. And so thank you, Dee Dee, for bringing that up, because it's a really important point, is let's stop it before it even happens.
You mentioned prevention and kind of the upstream. I'm looking at the audience, and I'm going to make facilitator kind of discretion. Senior homelessness is the fastest and largest growing population in the United States. We are seeing people who are on a fixed income. We are seeing people who had a great rental unit for many years. The landlord says, lease is up, you're welcome to stay here, it'll be 40% more, and those folks are looking around going, what am I going to do? And depending on your, safety net, what kinds of things, when you think about particular populations like that, be it youth or veterans or seniors or, whoever, are there particular things that you see that work really, really well maybe for one group that we need to just extrapolate or expand on across the board?
Go for it,
You
Don.
go first.
Don, do it.
Please.
Are we on to the third question?
Ish. This is facilitator's discretion. So.
So, Ian, tell me again what you were arguing.
Basically, that we know that senior homelessness is the fastest and largest growing population in the United States, and we're seeing these kind of the trends of what that's going to look like in 10 years. And we know there are particular things that work with particular populations. Like, if we could just do this with youth, here is something, how could we extrapolate that to another population? And so I'm just curious, as you think about working with either a particular population or homelessness broadly, what are those things that we need to really expand on or double down on across the board or for a particular population?
It's interesting that you turn to the most senior member of the panel.
You picked up the mic, Don. I'm just gonna point that out.
I very much agree with you. And one of the things that occurred to me while you were talking is the concept of social capital. And by social capital, what I really mean is networks of support and community. And all too often, particularly seniors, don't have lots of networks of support. What do I mean by that? Well, my way of describing this is, who do you call at 2 o'clock in the morning if you have a crisis? Fortunately, I'm married, so I can call my wife. And most of us here have people, family, friends, neighbors, church friends, neighborhood people that we can call on. Unfortunately, most of those experiencing homelessness don't have those kinds of support networks. And this is particularly true of older people who see friends pass away, who are really isolated. So how do we provide the kind of social capital that they need? And I want to mention a program that I am very familiar with. It's called Miracle Messages, which is out in San Francisco. And one of the things that they have done is create a volunteer phone buddy system. So for each person who was isolated in a motel, particularly during COVID, they would have a volunteer call that person once a week just to check in, chat, provide any assistance. And that's really expanding social capital. And I think we need to figure out how to expand that kind of effort substantially, particularly for the people that Ian mentioned.
Yeah, I think particularly with seniors, it is the fastest growing population of people experiencing homelessness. If you look like at the data trends, like you can see this, we're going to hit a crisis point with the aging population. And it's what is happening specifically in Denver is people, in order to be able to afford housing, have to keep moving further and further and further and further outside of the city, away from public transportation, away from their doctors, away from their community. And so there are a couple of things I think that are important. Number one is looking at how do we integrate healthcare and housing together, right? So we have a lot of people who might need some additional support in order to be able to live independently, but they can't afford it, or there's not housing for them. So being able to do that is really, really important. And I think that's, the same for any population, is you have to figure out what are the supports they need. So like youth, when we look at youth, a lot of youth don't want to live by themselves, particularly if they're coming out of like foster care. So allowing shared housing situations and setting up communities, like to Don's point, right, where people can actually have community and be around other people, because it is isolating, particularly if you're used to being in a group home or something like that, to just be like put in an apartment by yourself, not have things, and not be around your community. So I think the thing that we need to focus on is, what is that population, what are their specific needs, to be able to figure out how do we make sure we're serving them best, and that they have the capital, they have the wraparound supports needed.
Yeah, when you asked the question, I wrote down social connectedness. So we're sort of all kind of on the same page, right? And those can be loose connections, they can be tight connections. We know older people tend to get more isolated as they age. One of the interesting programs is a bit one-off, but if you've heard of Sunshine Home Share or Silver Nest, it's a matching service that matches older adults who might have vacant rooms in their house. Maybe they're widowed or widowed, maybe they had kids, and matches them with people that need a room, right? And that can be totally transactional. I've done this, I'm renting a room in my house to somebody. Or it can be involved like part barter, right? So you're gonna take me to the grocery store once a month, or to my doctor once a month, or walk my dog, right? And so this solves for a couple problems at once, right? Like social isolation it helps with fixed income for older adults, right? And so I think we also need to be innovative around how we think about some of this. And we have a mentality that is very much still, particularly in Denver, still like single family homes with a yard, all those pieces, right? And I think we need to rethink like what co-housing looks like, what social housing looks like, and all those pieces are going to help us solve bit by bit some of these problems, including the social connectedness, right? Some of the planned communities really try to create, areas where you're close by, but you have a common area. So the kids are going to be out playing, you're going to see your neighbors, that kind of thing. So that's like a kind of a up there answer, but I do think there's a lot of pieces there that we could do differently.
One of the things that you should be aware of is, and I'm not going to speak for Dee Dee because I don't know her that well, but I do know Jamie. And Jamie...
I'm really, really scared about what he's going to say right now. Like, genuinely, this man knows too much about me.
Hang on, Jamie. Just hang on. Jamie and I are data freaks. We love numbers. And I want to tell you a little bit about something called the GAP map, which is developed by the Colorado Coalition, the Colorado Center on Law and Policy. Every couple of years, they look at every county in the state, and they compare the number of people who are receiving WIC, the women, infant children, Medicare, TANF, SNAP. These are federal benefit programs, and child support. And they compare the number of people who are receiving support as a percentage of the number of people who are eligible. And I can tell you, Denver is not bad, but there are counties in this state where the actual recipients are 5 or 10% of the eligibles. And nationally, only a quarter of the people who are eligible for food assistance, welfare, or housing vouchers, only a quarter who are eligible actually receive them. That's all pretty scary.
So thinking about, you raised kind of this idea of social connectedness, social capital, being that we're here in a church, which for many people that is their social connectedness or social capital. What role do you feel that communities of faith have in both the conversation and the actions around homelessness?
I'll go. I'm going to tell a joke first, so be careful. What are freckles? I know you know what freckles are. The joke is, it's a great tan trying to get organized, right? And the point is this: there are a lot of different faith communities out there, and a lot of them are looking at this issue, but they're not bringing together the social and political and sometimes economic capital that they have sort of unified in one direction. I think everybody's working really hard, but I think there's a way to have a lot greater impact if across faith communities or among faith communities, everybody was sort of working from the same playbook or the same framework, right? And using their social, political, economic capital to like make changes in systems. So I think people in here, I'm probably preaching to the choir a little bit. You're here because you're interested. You have a church that's concerned and active. But I think we need like a bigger like sort of push that's really unified in the right places. And that's something I think that faith communities could do.
Unfortunately, choirs are at churches. So yes, we're talking to the choir. But as a colleague of mine that all of the panelists know, Leanne Wheeler, said to me not too long ago, the religious community is an underutilized community in terms of addressing homelessness. Obviously, Calvary Baptist is an exception, but there are many congregations that really are not doing very much. And this is tragic. One of the things that I feel very strongly about is the need for all of us to understand and not lose sight of the humanity of people experiencing homelessness. And this is a central religious value. So advocates, churches can be advocates for greater humanity. They can also be centers for education about homelessness. And finally, they can actually, particularly if they collaborate with other churches, they can become focal points and actually start major centers, service centers of various kinds. I was working with people in Portland, Oregon, some time ago, and there was a church there that collaborated with several other churches, and those churches developed a health care center for people experiencing homelessness. One parish couldn't have done it, but they all got together and worked together and accomplished great things.
Yeah, I understand you all do Family Promise right? That is like one of my favorite things. I think it's such a great model where churches come together to be able to, it's on no one congregation, but rather collectively work to support families. I think there's a lot of different things like that the faith community can do. You also have a lot of land. Collectively, the faith community owns a lot of land. And if you look at like downtown Denver, Cathedral Square, like they were able to, that land was donated by the church so that they could build affordable housing on that plot of land. Like things like that, those are like tangible things that would be so incredibly beneficial to our work, is if we could just have the investment of land to be able to do things like that. It's transformational.
So if our attendees, both virtual and in person, walk away from this evening with nothing else, and we hope it's not nothing, but what message do you want them to take back to their families and neighbors?
Okay. Actually, I'm going to ask you to do one of the hardest possible things you can do, which is interrupt the narratives you hear from the people around you, which is really hard, right? Educate yourself. And then when you hear misinformation and misperceptions, and it's the hardest, I mean, it's easy to do with strangers, right? Or it's much easier. It's hard to do with friends, with family members, with colleagues, with congregation members, but interrupt the false narratives and start correcting them, because I think that is a really, really critical thing, and it's such a hard thing to do. To, you know, I wouldn't say put the relationships at risk, but it's hard. It's hard to have that conversation with people you know. So that's my big ask. It's kind of a hard one.
Welcome, Cole.
Hi, everyone.
Yeah.
Where would you suggest that we send someone with the kind of information that you're suggesting?
May I?
So
Okay.
just, can you repeat the question?
Oh,
Yeah, she asked where anybody could get the kind of information to educate, to refer people, right? Yeah. Yeah, exactly, and it's real information, right? It is data. I am pointing now at Jamie.
I'm happy to surprise your friends. One of the things that our organization does is we oversee what's called the Homeless Management Information System. So that is a data system that is used by the providers across the region to actually input, kind of like a student information system or electronic healthcare records, same concept. And so we actually are able to capture data in real time of people experiencing homelessness, and we publish an annual report on that with lots of pretty graphics. And it is really a comprehensive report that talks about, like, what are the top causes of homelessness? 87% of people in Colorado that are experiencing homelessness are from Colorado. So this whole, like, people are moving here and becoming homeless, not true. It's all of those things in one handy dandy report. And I'm happy to share the link, or if you go on it's mdhi.org. It's on the top, it says State of Homelessness Report. That is very comprehensive. There's also an executive summary, if you don't want to read all 85 pages. But it is a really great place to really myth bust, because it's actual data in Denver Metro. So thanks for that question. I really appreciate that.
And I add one thing, which is it gets to, I think, Don's point about humanity. You can also ask people that you see who are living on the streets or experiencing homelessness. You can actually talk to them. And I'm not being sarcastic, but, like, I think sometimes people, like, I stop and talk to people. I bet you Don and Jamie do too. That is also a really great source of information outside of data. Like, what are you actually experiencing right now? So I just wanted to add that too.
People would guess that you're a plant, because this is a wonderful segue into something I wanted to mention. And that is, I have 2 books, another one coming out full of lots of good information. All of those books are free. So if you want the two that are out, grab one of my cards, which is they're on the table over there. Email me, tell me you want the books, I'll send them to you. I'll even, if I can figure out how to write my name, I will even inscribe them. And then the other thing is we have a new book coming out, and we have a special event in December as a book signing and community conversation at the Newman Center. And there are cards about this over there also. So thank you very much for your question.
I'm going to just go back to if attendees walk away from today with nothing else, what message do you want them to take back to their families and neighbors? And Cole, since you didn't hear that initially, you can perseverate on that while maybe others want to respond on that too.
Go ahead.
Yeah, I think, I kind of talked about this earlier, but just there's a real misalignment between the causes of homelessness and the realities of homelessness. And please be ambassadors, be allies to people experiencing homelessness and housing instability. Spread the truth about this issue, that it's not a choice, it is economics, it's systems, and just help change the public narrative. Because here's what I'm going to say. The reality is that we can't do any of the things we're talking about today if the public narrative doesn't shift, if the public mindset doesn't shift, because it's a lot of blame on the individual. And until we help people understand that's not the reality, it's really hard to create change and create housing and, do a lot of the things that we need to be able to do to really address this issue. So be ambassadors, and I really do appreciate your question. And the fact that you're showing up here on a Tuesday night to listen to this, I'm really impressed. So thank you for being here and for your interest in this.
Good evening, everyone. Is this on?
Yeah.
Yes, you need to speak
you
really
need to go
close.
just like this.
So, sorry I'm late. I'm Cole Chandler. I'm Mayor Johnston's Senior Advisor on Homelessness Resolution. Talk louder. Talk more into the microphone. Okay. I'll crouch awkwardly, just trying to look at you. So, Cole Chandler, Mayor Johnston's Senior Advisor on Homelessness Resolution. I'm late because I was with a less friendly audience to having a neighborhood meeting about some micro communities around town, which you might have heard about. And so I just, to give you a little bit of my background, come into this work as a moral leader, frankly. I did a Master's of Divinity degree, finished that 10 years ago, studied theology with an interest in thinking about the intersection between theology and social justice, and found my way into housing justice work through the Denver Catholic Worker House, and then became a co-founder of the Colorado Village Collaborative several years ago. Spent the last year as the Director of Homelessness Initiatives of the state of Colorado, and then was pleased to be Mayor Johnston's appointee to lead his homelessness work. So I think one thing that I would want you all to know is that I have long felt like the reality of unsheltered homelessness on the streets of Denver was a solvable problem. And I think you'll hear Jamie often beating the drum of the reality that homelessness is solvable at large. We have made progress, we are making progress from a system level. When we think about homelessness in the point in time count, we break that number down into different groups of people that are either in emergency shelter, transitional housing, and or unsheltered. And the point in time count shows that there's about 1,400 people on the streets of Denver any given night without a good place to go indoors and be safe. And I've always felt like that was actually not an overwhelming problem, that 1,400 people is the size of a high school, not the size of a Midwestern city. And so if we brought the right amount of focus and political will and leadership to that problem, that we could make a significant impact. And so on Mayor Johnston's first day in office, he declared a state of emergency and has brought that leadership and focus. And we are laser focused right now on addressing the challenge of unsheltered homelessness on the streets and bringing 1,000 people indoors. And so We are making progress towards that goal. We have brought 175 people indoors since July 17th, and we've got a lot of units in the pipeline that are going to be opening later this year. We have closed on a 195 unit hotel, closed on a 95 unit hotel, just filed a lease agreement for a 300 unit hotel, have broken ground on a 54 unit micro community, a 120 unit micro community. If you're doing calculator math, we're getting pretty close to 1,000, and now we got to get them open. And so I think the one thing I would say to you is that we can make significant progress on this issue, that people don't have to live on the streets, that people don't have to suffer, and that we actually as a community have a moral calling. We have a moral commitment to work to address that. And doing so requires us working together. And it also requires us addressing our own discomfort around this challenge. And so I spend a lot of time talking with neighborhoods around their discomfort about this problem. And we are working to do everything we can to help people overcome that discomfort so that people can come indoors and thrive. And so this problem is solvable. We have a path out of it, and we can do it together. And I hope you leave knowing that tonight.
Let me echo what Cole and Dee Dee and Jamie have said. Between 2011, roughly, and 2009 and 2013, thanks to the efforts of President Obama and the Secretary of the Veterans Administration, Sean Donovan, the political will was there, and because of that, the resources were invested in trying to address veteran homelessness. And over the course of a few short years, veteran homelessness was reduced by 50%. And I take that to mean that if the political will is there, we will then invest the resources necessary to address the problem. If the political will is not there, and you all help to determine the political will, if the political will is not there, we're never going to solve this problem. So each of you has a role to play in making sure that decision makers understand and appreciate what can be done.
So the final question from me, and then we're going to get to audience questions, is really around, we know that homelessness is a traumatic experience for individuals and communities and neighborhoods. What gives you hope for this work in the year ahead? And in particular, if you have a recovery or a resiliency story or a recent win that you can share. I always like to end on that note.
I'll go. I got it. Don, I got it. Yeah. Okay. Yeah, I think, and Cole, thanks for teeing up homelessness is solvable. I appreciate that. If you know anything, none of you have been in a Zoom meeting with me, but on my home office, I have a sign behind me that says homelessness is solvable, because it is. And I think that's the high note I want to end on is, Don was just talking about national reductions in veteran homelessness. What I'll say here in Metro Denver with a really, really concerted effort around collaboration, engaging different sectors and things like that, we've reduced veteran homelessness by 40% in the last 3 years. And this year alone, we've reduced another 20%. And that is because we have all worked together and come to the table, created locally accountable teams that said, we can do this. And we're going to work towards doing it and figuring out how we can actually end veteran homelessness in our region and be the first major city to do that. And we're on track to do that by the end of 2025, which is incredible. And if we can do it for veterans, we can show that it is possible for other populations as well. So I'm excited about the work we're doing with veteran homelessness. I want us to be a region where no veteran doesn't have a place to stay. Like, there's no reason why we should have veterans experiencing homelessness in this country. And I want us to be the region that shows that no one should be. And so that is I'll be honest, it's the work that gets me up every morning and makes me think like, okay, it is worth it. This is solvable and we can do this. And so I'm grateful for that opportunity and what we're proving is possible in Metro Denver.
Yeah, I thought long and hard about this, actually, and we always celebrate successes with every one of our community members who moves into housing permit. Like, it's always a story, and it's always a heartfelt story, right? But I'm also wary that we often, first of all, I want to say everybody who is unhoused in a shelter is working so hard, right? If any of you have done a Medicaid application, 56 pages, enrolled in Medicare, anything like that, right? It is so hard. And imagine doing it a lot of times over for all these different programs without some of the advantages you have. So people are working so hard every day. But we tend to highlight exceptionalism, right? Like, we love to do that. The person in our community, and there was one recently who was only there 2 months, like, boom, out and like in their own place. That is great, but I have a huge amount of respect for the person that's been there 5 years and slowly making progress all along that journey. So just, I think the thing I would say is that everybody is working really, really hard, and have respect for that, and however long their journey takes, because it's different for everybody. And I just like that exceptionalism. Sometime I'm just like, anyway, that's what I had to say.
I have two responses to the two questions. First of all, I am hopeful because we have good people in the right places. Jamie, Ian, Dee Dee, Cole, and the mayor has demonstrated a real commitment and a passion with all of the right instincts to try and solve this problem. So that gives me hope. Now let me tell you a story, and I'm going to tell you this story briefly because it really represents what you all can do. I was at a stoplight not too long ago, and a young guy held up a cardboard sign that said, "I'm not cute enough to get housing. Please help." And I rolled down my window and said, "I'm sorry, I don't have anything to give you. But I think you are cute enough." And he slapped his leg and started laughing and said, "That is the best thing I've heard all day." Just taking the time to get to know somebody. When you're at a stoplight and somebody is panhandling, at least wave at them. Say hello. I mean, people say, "What's the worst job you can think of?" Well, the worst job I can think of is standing in the rain for 6 hours and watching 98% of the cars that go by you ignore you. And you get pittance. Let's show some humanity for those who are less fortunate than we are.
So, thanks, Don. I think one thing that gives me hope is that we had a vision for a long time that there was a better way to address encampments than just moving them from block to block. Back to my early days in advocacy, standing on streets holding signs that said "move along to where," we always felt like there was a better place to move people to, and that better place is to housing and to micro communities and to low barrier shelter options. And we had the opportunity back at the end of September to close our first encampment through those housing options. And so there was a group of people that was camped at 8th and Logan. And we went into that encampment full of people who, might not have thought they were cute enough to get into housing. And we told every single one of them that they were. And so we went into that site and we sort of salvaged all the available housing resources we had. We just opened a hotel. We had 70 rooms available in that hotel, and so we kind of went in thinking, okay, we've got space for 70 people. Well, there were more people than that in the encampment. Fortunately, there were 13 couples, and so we had 83 people from that encampment go into hotel rooms. And then we had great partners like the Colorado Village Collaborative say, hey, we've got some sites available in our SOS, and so we had space for 5 more people. But we were able to, instead of showing up at an encampment and closing it and moving it down the block, which just moves all of the challenges related to the encampment down the block, we were able to bring 88 people into safer locations, and not a single one of those people that was at that encampment formally declined the services that we offered. And so that was a moment that gave me great hope and continues to propel me every day as we're working to bring units bring units online. We just started our second encampment resolution, and we'll be wrapping that up on November 1st, and we'll have another 50 units that we're aligning people towards as they're going inside. And so just seeing that we have a better answer to move along to where that we can actually say there's a place for you, and you deserve to be inside, and that people are willing to take us up on that has given me a lot of hope right now.
And I'm going to do an acronym check. SOS is Safe Outdoor Space. They're the safe, secured camping spaces that were set up during COVID that have 50 or 60 tents with surrounding wraparound services, hygiene, all those sorts of things, just in case you didn't know what a SOS was.
Cole, that housing is, I've heard it's temporary. What does that mean? And when do these people have to find other housing?
Sure. So, so the question was, is that housing temporary? We know that the solution to homelessness is long-term, permanently affordable housing and people being leased up in their own units. And the reality is that it takes a long time to develop those, to get those available. And we are working on all those strategies. One of the things that we have felt like we could do quickly was scale up some of the hotel options and some of the micro-community options. The first site that we opened is a hotel site that's opened as non-congregate shelter. But there's no time limit on how long people can stay in those sites. They're welcome to stay there as long as they're abiding by the community agreements and making progress towards their longer term housing outcomes. And so there's case management and wraparound services at that site that's focused on helping people take those next steps once they've been stabilized in that particular site. I will say that site is planned to become permanent supportive housing after a few years. And so we're beginning a rezoning process on that site, and we will begin to work on the financing for converting those units to long-term permanently affordable housing. But right now it's open as a hotel, and there's no particular time limits on how long people can stay there.
So I want to thank our panel for that part of the discussion, which is great. I'm going to dig into the questions from all of you in the room and virtually. Thank you to Ann and Pat and Corey for collating these by theme. So we're going to try and capture some of that. I want to start off, the big, scary, hairy ones, right? What about drugs and mental health and all these things that right, it takes such a big part of the conversation and the narrative around homelessness. And so in particular, I do want to frame, though, really around how do we best respond to those who are on our property or in our building who are either using drugs or having a mental health crisis. How do we effectively refer them to places more equipped to help them? And they come to us, this is from a faith community, they come to us as a faith place seeking help and safety, but we are often not equipped. And we know that, right, there are not enough services around behavioral health care for folks. So just kind of, can you talk about the narrative around behavioral health, specifically substance misuse and behavioral health, mental health needs, and really, what does kind of the general public do when they see someone in crisis?
I have several responses to that. First of all, if you consider the total population of people experiencing homelessness. The data suggests that, 25 to 30% of all the people are substance use, suffer from a substance use disorder. And about the same percentage suffer from serious mental health disorders. So it's not as though everybody suffers from that. A second response is the conventional wisdom is folks experiencing homelessness are lazy, crazy, drunks, druggies, or they've made bad decisions. However, there are many thousands of people, more than that, in housing who are lazy, crazy, drunks, druggies. And please, if you have never made a bad decision, raise your hand. So think about it. What would you do if one of your neighbors had a problem with alcohol or drugs? You'd figure out something to do. Why don't you do the same thing for somebody who doesn't have a home? The other response I'd make is, unfortunately, this city doesn't begin to have sufficient resources to address substance abuse, drug abuse, alcoholism, or mental illness. And when Arapahoe House closed 2 or 3 years ago, that just made the problem worse. So we have got to invest in developing the kinds of centers that we need to help folks.
You know, there are a lot of answers to that question. Practically in Denver, one of the answers is the STAR program, which I'm going to forget what STAR stands for, but it's a program in which they will send social workers, licensed social workers, and mental health specialists out instead of like police or fire, if they assess that actually is what the need is there. So the STAR program, I think, is particularly something that everybody should have awareness of and feel comfortable calling. And to Don's point, I came from a public health adjacent space to this work. I know that pre-COVID, 59% of emergency department admits were alcohol related. Those were not all from people who are unsheltered and unhoused, right? That's a small percentage of the population that makes up unhoused and unsheltered. That is folks like folks in this room, right? And so to Don's point, when we think about...
Not me.
No, when we think about, you just said you want to have a scotch earlier this evening, but I just want to really highlight that, like, you know, these are diagnoses, these are issues that everybody deals with, and often they're hidden among the housed, but not among people that are unhoused.
All right, I'm going to switch to another one, which is, you know, we've talked a little bit about people who are working. There's some concerns. This is, I think, really interesting, right? Today's job market is predominantly service-based. And as we see advances in technology and artificial intelligence, how do we address, you know, future unemployment concerns? And I think this is getting at that upstream, seeing an increase in homelessness and an increase in people who are unstably housed as a result of, you know, technology and those sort of things. So, Don, I'm going to ask you to explain artificial intelligence, and we'll go from there.
What little intelligence I have is not artificial.
I'm just going to jump in and say, when you talk about AI, first of all, I'm using it for grant writing and taking board meeting minutes, and it's amazing. But, I read something recently that AI can actually help lower skilled workers upskill, right? So it can actually be helpful. So before we jump to conclusions about the impact of AI, you need to understand all the pieces, right? That's where getting good information is important.
Again, let me throw some numbers at you. The National Low Income Housing Coalition every year reports on what they call the housing allowance, or the housing, what do they call it?
Wage?
Hmm?
Wage?
Housing wage, thanks. I knew I needed Cole.
You need artificial intelligence to help you.
Yeah, he's not artificial either. And the housing wage this year, nationally, across the country, and the housing wage is what you have to earn on an hourly basis to afford an average 2-bedroom housing unit. The national housing wage is $31.25 an hour. In Denver, it's even higher than that. In Boulder, it's over $50 an hour, which is why I don't live in Boulder. Our current minimum wage in Denver, it's going to go up, but it has been $12.85. It's going to go up. So up to what, $15, $16 an hour. That's roughly half of what you need to afford an average 2-bedroom housing unit. It's unacceptable. So we desperately need to increase wages. And we need to figure out ways of reducing the cost of construction of housing so that, in fact, housing becomes more affordable.
I'm going to add to that a little bit. So it's definitely the cost of housing. Like Don just said, you stole my thunder, Don. You stole my data. You stole my data. That's okay, though. That's okay. But what I'll say is, and we saw this a lot during COVID, it's not just, the wages. It's everything that goes with that. So childcare costs, healthcare costs. We saw a lot of specifically females not re-enter the workforce after COVID because of childcare costs and the inability to secure childcare. So yeah, you could be making, even if you're making $20-some an hour, if you're paying $2,000 a month in childcare, you absolutely cannot afford housing. And so it's all these other systems too, healthcare. If anything happens and you have an unexpected healthcare cost, it's all of these other things that contribute to the fact that people are just so housing burdened right now, and unable to afford just basic life necessities.
So I'm going to riff off of that. So you have centered permanent housing as a destination for everyone, and some of these questions are really around. Can you talk a little bit about the needs of the wraparound services to both get people housed and keep people housed once we've done all this work to get them into that space, and in particular, things like you mentioned around childcare, and can you just elaborate a little bit on these wraparound services that we've kind of referenced?
Sure. And I want to go back to kind of this earlier thing we talked about. No one experience of homelessness is the same. So what we find is there may be a family that we talk about who needs $1,400 of prevention to just make sure they don't become homeless, right? Or they just need a shallow rental subsidy for, say, 9 months to become rehoused. That's one set. And then the other end of the spectrum, you have people that may be permanently disabled and they need a lot more supports, whether that's case management, mental health, substance use disorder, all of those things. But there's a whole wide spectrum from just some sort of very, kind of subtle service to very, very intensive case management and supports. And what we need to be able to do is really make sure that we have a full spectrum, because neither of these is going to fit everyone. So again, that goes back to not a one size fits all, but rather like we need all types of different supportive housing and different types of case management and things like that to meet the needs of different populations.
I'm associated with a program called Elevated Denver, and they had a podcast the other day about hospice care for people experiencing homelessness. And interestingly enough, hospice care, the concept is somebody comes to your home to take care of you in your last days. What happens if you don't have a home? What happens to hospice care? And there's a brother who created a facility to take care of that. And over the course of several months, they've provided hospice care for 25 people, most of whom have died in that facility. It includes housing and care. The problem is this poor guy ran out of money. So that center has now closed. What do we do for, and I'm a senior, so I think about this a lot. What do we do for people who are coming to the end of their time, particularly if they don't have a home? We've got to provide some kind of care.
I think I just want to jump in and say, having come from sort of the health sector, that some of what we're talking about, like the need for mental health services, is so far beyond just people that are unhoused and unsheltered. There's a much larger crisis of access even for people with good insurance, right? There's sort of a death spiral going on in terms of people leaving, taking any kinds of insurance, right? And so I just want to call out that that's not specific to the shelter in the house. It might be even harder there, but for most folks, access is becoming increasingly difficult.
So Don, you mentioned Elevated Denver, the podcast, which I would also +1. I'm looking at this group and I'm like, you've been on it, you've been on it, you've been on it. Yeah. But wondering if you could share, a book or a resource or something you would really want to highlight for folks to get educated or to address questions about homelessness. Jamie, you mentioned the State of Homelessness report. And this one I love is that, in particular, if there's any to use with kids. When your kids have questions about when they see someone or are concerned. So just a resource or book question. And Don, I have a sense of what books you're going to recommend.
Yeah, Ian knows me too well. Again, there are copies of 2 of the books over there, and if you want free copies of those, grab my card and send me an email. Come to this event and you'll get a free copy of the new book. It's not specifically about homelessness, but Matt Desmond's new book, Poverty by America, is one of the most insightful and profound books, and the degree to which we are all responsible for creating that. Matthew Desmond, I shouldn't say this, but I think it's a much better book than his former book, Evicted. which was at the top of the bestseller list for eons. But Poverty by America, everybody should read it.
I just read Don's books.
I'll share one book that shaped my thinking in the last couple of years. It's called Homelessness as a Housing Problem. It's by Greg Colborn, and there's two authors. I can't even think of the second one. Anyway, fantastic book that looks at homelessness not necessarily as an individual, from an individual's perspective of why do people fall into homelessness, but from a regional perspective of why do certain regions have high per capita rates of homelessness. And unequivocally, the data shows that it's not because they have really nice weather where homeless people want to be, or they have higher divorce rates, or they have higher rates of alcoholism and mental health. It's two data points. It's when vacancy rates decrease and cost of housing increases. And so when you look at that regionally, when you see those two data points, you see regional rates of homelessness rising. And so I put that book out there. I was about to say I +1 it. I love that book. A book that I read to my kids, I have a 4-year-old and a 1-year-old, is called I See You. And it's actually a wonderful little children's book that's all pictures and no words. So it tests my storytelling ability every night when I go through it. But it is the story of a person who's experiencing unsheltered homelessness, living in a community where the only person that sort of sees her is a child who notices her from his bedroom window, notices her when he's walking down the street with his family, notices her and notices the way that the culture around her is treating her. And by the end of the book, this child sees this person on a cold night and goes out with his parents and gives her a blanket. And so his seeing her makes her visible to everyone else. And so throughout the book, she is in black and white and everything else is in color. And then by the end, she's fully in color. But it's a good one that I like.
Yeah, I'm going to +1 your book, Cole. It's a great book. I highly recommend that. I think, so not to self-promote, but Don and I did co-author a book called Journeys Out of Homelessness, The Voices of Lived Experience. And I think one of the things that's often lost, and I'm a data person, I talk about data all the time, is like the humanity of this issue and the types of people that experience homelessness and their journeys and how they got there. And then really what helped them eventually become stable and get out of homelessness. So the book is over there on the table, but it's actually about people here in Colorado. These are all people, these are in our community who've experienced homelessness. They wrote their own stories. And then Don and I worked with them to craft, like, what are the policy implications? What needs to change from your perspective as someone who's been through this journey? And I just think it's a really important book because it's stories, and it helps you understand how people get to this point and how they got out of it too. And then also, what do we need to change at a national level, or what policies do we need to change locally in order to be able to really help get us out of this issue that is homelessness as we see it today. So I think it's just a really great book to understand the narrative as well as some changes and things that we can all do.
One of the great things about gatherings like this is you meet old friends. And one of them, Janet Woodward, came up to me and said, "You probably don't remember me, but I was at a silent auction, and you told me about your book, and then you persuaded me to buy your wife's painting." And she shows up, and here's the book. And Janet, thank you.
So I'm gonna wrap it up there. I really want to thank the panel just for your time and your insight, and certainly the audience, both virtual and in the room, for just your engagement and for being here, right? That in and of itself is a step in the right direction around, as I talked about, changing that narrative and learning. So I think that's really critical. So just want to,
Can I
yeah.
get one more small thing in?
Yeah, please,
Do you
Stevie.
mind? Sorry, I just want to say, so I'm with the Colorado Village Collaborative. As most of you probably know, the mayor and his team are really looking at micro communities, which are our model, both safe outdoor spaces and tiny home villages, as part of his really initiative to house 1,000 people by the end of the year, unsheltered, unhoused Denverites. People have a lot of questions and concerns. I'm sure Cole has been hearing about those at many of the meetings. And while we try not to overwhelm the people who live in our communities because they're their homes, if you're really interested in learning more, you can contact me, and sometimes we have site tours so you can see what these communities are like. We have found that people who are concerned, once we move a community into a neighborhood, almost entirely those concerns are abated when they see how they're run and the people in there and the use agreements. And so I just wanted to put that out there, particularly if you have concerns. I will work with you to try to figure out how to show you what these communities are like and what they feel like. So I can't do 20 people at once, but we'll figure out a way to make it happen, because I think it really does change hearts and minds when people have a chance to experience those communities. Thank you.
Thanks, Steve. All right. So just want to give a round of applause to our panelists. Thank you for your time. And just also to plug, if this was of interest to you, and if you would want future conversation, right, this is in response to hearing about what, in particular, this faith community has experienced and is trying to understand, as well as other faith communities and the neighborhood. This is all dynamic. And so if there are future conversations or future topics, we welcome those. And so on your way out, just flag with Ann or Pat, that you would want to be connected for those kind of things. So again, just thank everyone for your time, and just
Thanks
thank
for
you.
being here and having an
Thank you.
interest.
Seriously, thank you for being here.
Thank you all for being here.
All right. How you doing?
Good.
Good.
Okay.
At some point, I
Yeah.
know you're busier than
Yeah.
one on paper.
Yeah. I struggle with my schedule a great deal. Yeah, including tonight. I'm sorry I was so late, but was glad I was able to make it.
Yeah. Well, great to see you.
Yeah. Yes, sir. Yeah. Yeah. What's up?
Thanks, Don. You're super helpful as part of my education and onboarding, so I just really appreciate you.
What I've noticed,
Plus you're fun.
doing that, but I've noticed I'll drive down, it'll be a large encompass.
We're going to be seeing each other.
Okay.
And then
If I need to turn that off.
Sure.
what happens? Are those people taken to hotels? Or what?
Yeah. So the reality is we're not closing a lot of encampments right now.